Hey everybody, it's Dr. Dave, Psychiatry. Thanks for joining me on my YouTube channel. Today we're talking about what it's like to not be able to shut your mind off. The topic of overthinking and the topic of dopamine excess in my office. Not being able to shut your mind off can cause a lot of problems. It can range from I'm laying in bed and I'm thinking, can't shut it off. It can be a guy just cut me off in traffic and I started thinking about all the bad things that ever happened to me, and the next thing I'm in the middle of a road rage accident. It can be my wife said something little to me and I just can't let it go. It can be I can't have social interactions because I keep wanting to say things to people and I can't listen because my mind is just going and going and going. A lot of times this gets labeled attention deficit disorder, ADHD, because people are sort of hyper, but oftentimes it's not. So today we're going to talk about overthinking and dopamine. If you want to get more about this and sort of the background, you should watch the video that's called Troubleshooting Brain Chemistry, where I sort of give the introduction to that. Today we're just going to specifically talk about dopamine, as I normally do. I draw two lines. The normal range, high and low. I want you to be in the middle, not too low or too high or any of your chemicals. And today we're talking about dopamine, which you probably heard me say before if you've watched other videos. Dopamine is the chemical that's really misrepresented for me on the internet, because back in the 80s and 90s, when dopamine was really being discovered and we were really discovering the brain chemicals, there was a lot of talk about dopamine being the feel-good chemical and the motivating chemical, which in some sense in the interior brain it is. But in my office, the reason I believe that dopamine excess is the problem, not shortage, but too much, is that medicines that push down dopamine activity, so the dopamine suppressors, ones that push it down, help people think less and worry less. So people that make too much dopamine, I call them overthinkers. They call themselves overthinkers. And the umbrella is overthinking. So again, overthinking can be any number of things. Can't shut my mind off about this or this or this or this. But the fundamental thing is can't shut my mind off. And if you've ever talked to somebody who it's just impossible, sometimes in my office what I have to do, when people start to get irritating, where they just won't let me talk to them, sometimes that's a signal to me that that they have a dopamine excess. I remember the first time I ever got thrown up on in the emergency room. It's a feeling that you have. You're just being overwhelmed. And in the same way that people with a stomach or a bowel obstruction will throw up, people that make too much dopamine, they just won't stop talking. They will just talk and talk and talk and talk. And I'm not talking about, hey, they're just excited. I'm talking about they won't stop to listen because they're 3 sentences ahead. And that can get you fired from your job. That can get written up to the factory because you're thinking so much that you're not doing. So overthinking is a bad problem, and it's really, really under-recognized because a lot of people are scared or maybe reluctant to use the tools that we use to suppress dopamine. I'll start with one because we use it pretty routinely. It's called Seroquel, quetiapine. Now, if you go to the internet and search Dr. Google for Seroquel, you will read all about schizophrenia and antipsychosis and antipsychotic and psychotic conditions. Psychotic meaning, technically, it's what average people use the word crazy when someone believes the Martians have landed, put a chip in their head, broadcast their thoughts on the radio, hearing voices. That's what average people call crazy. And when that's not caused by an infection, which would be delirium, that is called psychosis. Doctors call that psychosis. That's the definition. Symptoms not in touch with reality. When people are making, let's just pull a number out and say 1,000 times too much dopamine. And there's no way to measure this, but let's just pick a number. If you're making 1,000 times so much dopamine, yeah, honestly, you could believe the Martians have landed. And I see these patients in my office. Martians have landed, put a chip in my head, think I'm a bag of worms impersonating a person. The FBI is listening to everything I say. What you would call paranoid. And it's not just I'm, nervous that people are out to get me. It's literally the FBI is following me. If you're making 1,000 times too much dopamine, you're going to have completely abnormal thoughts. And that medical condition is called psychosis. Well, what if you're only making 20 times too much dopamine? What if you're not here, but you're here? Well, You know what the symptom is? Can't shut your mind off. Can't stop thinking about things. Can't stop worrying about things. Little thing happens, lay in bed, think. A tiny thing happens and it upsets me. Can't let things go. So what I call low level dopamine excess, as opposed to the psychotic level dopamine excess, low level dopamine excess is responsible for this overthinking thing. And we treat that in the office with medicines like quetiapine, Seroquel. But again, if you go on the internet and read about it, you're going to read about schizophrenia and things. If you have this low level thing, you got to understand you don't have psychosis because I'm giving you what is called on the internet an antipsychotic. That doesn't give you the diagnosis. That just turns out the term antipsychotic really is something that had to be done for approval by the FDA for these medicines. So as a group, the medicines that include, the Seroquel, Zyprexa, you might have heard of Abilify. Certainly commercials are out there for Vraylar and others. As a group, they're called antipsychotic, but chemically, what do? They're just suppressors. They just push down dopamine. Now, for example, you see a patient that they deny they're depressed. This is a case example. Somebody I saw this week, maybe. Not depressed, interest is good, happy, not having any conflict, motivated to do work, concentrating okay, great. Having panic attacks? Nope. Scared to be in public places? Nope. Just can't shut my mind off. Okay, well, when is it worse for you? It's laying in bed. I just can't shut my mind off. Just can't let things go. Okay. For a situation like that, I got two choices. I can give a traditional sleeping pill, like an Ambien or a Restoril, which we can talk about later. But those are basically just sedatives. They don't do anything to push down dopamine. So I'm not just trying to sedate somebody. I'm trying to work where the action is. If I believe somebody's got a dopamine excess, if I believe they're thinking too much, this is what I want to do. So a tool that pushes down dopamine, particularly a tool that is sedative, might work for that person. Now, I'm not telling you to do this. This is not a treatment channel. This is an educational channel. But if you're talking to your doctor, your prescription writer, and you have this issue, I do this a lot. 50 milligrams, 50 to 100 milligrams of Seroquel can just magically quiet your mind. It's not magic. It's dopamine suppressive. It pushes dopamine down. It's not magic at all. But people describe it as magical. They'll say, Doc, why didn't I try this before? Why didn't somebody offer this to me before? Well, the reason is that they might not want to be giving you an antipsychotic. The word antipsychotic might be scaring them. So the point is that you have to adopt the language of dopamine suppression. I'm not giving you an antipsychotic if you don't have psychotic symptoms. And what does the medicine do? Even though the exact mechanism of action is unknown, what we believe about these medicines is they decrease dopamine activity. That's what they do. They push down dopamine. So whether it's sleep, not being able to shut your mind off, things getting in your way, it doesn't have to be a psychotic, in layperson term, crazy for you to benefit from a dopamine suppressor. This is what we call, I'll just touch on this for a second, this is what we call off-label use. Off-label use is not important to you as a patient, but if you're a prescription writer, this matters. Off-label means these medicines were not officially approved for insomnia, generalized anxiety disorder, things like that. And that doesn't, just because they're not approved, doesn't mean they're a bad idea. If you clinically have a reason for it, if you document the reason for it, the patient agrees to it, agrees to the risks and benefits, then it's something that can be tried. And what's the worst thing that happens if you don't do well in the medicine? Stop it. What's the first thing you do when you have a medicine trial that doesn't go well? If you don't like how you feel in the medicine, you stop it. So really, I believe that the treatment for dopamine excess is really probably not nearly what it should be. And most of the patients that I see in my practice, again, seeing dozens of people every day, all week long, it is very common that I have patients that have been tried at all the what you'd call antidepressants, the serotonin booster, norepinephrine boosters, and the GABA boosters, what you might call the benzodiazepines. I see people that have been tried with lots of those, but nobody's tried a Zyprexa or a Seroquel or Abilify or Perfenazine because they probably either didn't think of it or they were nervous about the term antipsychotic. My encouragement to you is that if you need a dopamine suppressor, you don't have to have psychotic symptoms to benefit from a dopamine suppressor. And if it helps you, you'll know. And if it helps you and you know, you'll ask to continue it. So that's a little talk about what to do when you can't shut your mind off. I hope it's helpful to you. I hope the understanding is helpful to you. And I hope that you are getting some things out of this YouTube channel. Please share it with your family and friends, and obviously subscribe if you feel like it's useful. That helps get the information to the top of the pile for somebody who searches something like, I can't shut my mind off. Hopefully that'll get a video into their hands right away. I'm Dr. Dave Psychiatry. Thanks for coming to see me.